I just wanted to take a moment in deference to acknowledge the struggle and challenges our communities in this beloved state have been faced with the last few days. And Senator Hayden, Senator Champion, Senator Cohen, Senator Limmer, I believe Senator Kiffmeyer, I think you have part of Hennepin County too, our fellow Hennepin and Ramsey counties and our colleagues, excuse me. I hope I can speak for all of us that we, along with our communities, want to express and mourn for the life of George Floyd and express our sympathies to his family. The injustice that so many are feeling must be recognized and must be allowed to express these feelings. However, that outcry of injustice has been lost to this boldness of violence, and that is wrong. So we also mourn the effect that it's had throughout the nation. So now our prayers and hopes must be far-reaching so that soon we will heal and find peace and brotherhood and rebuild together again. With that, members, we have some work to do today. We welcome Senator Franz. I call the Senate Finance hearing to order. So good morning to everybody. We still have a COVID crisis on our hands, and it's important to keep the legislature have the legislature keep an eye on some of the federal funds as it relates to the state's COVID-19 response. I would actually, we have Commissioner Franz with us. Welcome, Commissioner. Glad to see you. But first, I think we're going to have Mr. Eric Nauman run through a spreadsheet that we've put together with current expenses, Senate expenses, House proposal. It is going to show up on your screen here shortly. And if you could, Ms. Young, if you could get that up on our screen, that would be great. And you should all have this in your inbox too. Thank you. Mr. Nauman.
Madam Chair, members, good morning. I hope you're all doing well. I thought what I would do is walk through a spreadsheet that House and Senate fiscal staff have attempted to reconcile, given some of the challenges of tracking the various proposals that were in play at the end of the legislative session. So this is our best attempt to reflect the Coronavirus Relief Fund. And in particular, this spreadsheet we're calling this spreadsheet to your attention because that's the primary topic of this particular committee meeting is what did the Senate and House propose during the recently concluded legislative session. I want to pause here and make sure that the commissioner is seeing the same thing that I'm seeing. There should be a spreadsheet on your screen. I think this might be the first time this has been presented in a formal way.
Yes, I got it. Thank you.
Okay. Thank you. So, Madam Chair and members, lines 1 through 8 should be relatively well known to all members. Minnesota received a distribution from the Coronavirus Relief Fund through the CARES Act of $2.186 billion, almost 2.187. Of that allocation, of that distribution, Hennepin and Ramsey County, because they had populations in excess of 500,000, were eligible to apply directly to the U.S. Treasury and receive distributions in accordance with their population size. So Hennepin and Ramsey collectively received $317 million. I'm doing a little bit of rounding. On line 8 is the amount that Minnesota received, and it's a simple subtraction from the total Minnesota distribution from the Hennepin and Ramsey distributions. So Minnesota is left with 1.869, really 1.87. And this is the amount that the remainder of the lines really address. So during the legislative session, there were a number of bills that were processed through both the House and Senate. Of note, the one that received consideration in the Senate Finance Committee was one that's being colloquially referred to as the federal conversion bill. Senate File 4563 was a bill that took appropriations that were enacted as from the general fund and converted them to the Coronavirus Relief Fund. And the Senate bill proposed to convert $333 million of those appropriations, including some of the action orders that were part of the COVID-19 Minnesota Fund. There were 3 of those. The House had publicly posted an amendment prior to a Ways and Means Committee, and for reasons that are not known to me, that amendment, the bill was never taken up in the concluding days of the session. But the House had proposed removing the tribal nations grants from the Senate proposal and then added 2 additional action orders. And I think the addition of those 2 action orders was more a question of timing, because the Senate bill processed earlier than those action orders were made available or were requested. Then on line 30, the House and Senate both processed, well, at least the Senate processed off the Senate floor, the House processed out of the Ways and Means Committee distributions to local governments of roughly $2 million of dollars distributed to cities, counties, and towns throughout the state. This would be money that would be appropriated to the Department of Revenue in both cases, and then shipped on different formulas and different processes directly to cities, counties, and towns. The 667 represents what we thought was the proper calculation of 45% of the total state distribution after accounting for Hennepin and Ramsey County. We'll come back to that topic, I'm sure, in a few moments, but this was intended to be the balance of the 45% that has been discussed in a number of quarters. On line 36, 37, 38, both bodies processed bills relative to small business assistance. The Senate processed its bill in the form of grants. The House proposal was $50 million of loans. Then both bodies had some amounts for broadband, $20 million in the case of the Senate. There was a sizable amount of conversation in the Senate Finance Committee about Senate File 4494. And the House had $27 million as part of its proposal. The Senate only had a proposal in the form of Senate File 4130. I think this was an Utke bill that made workers' compensation appropriation of $375 million for workers' compensation claims relative to the presumptive eligibility for first responders. And then the one item that was enacted out of the CRF during the legislative session was what we're calling the agriculture omnibus. There was $600,000 of appropriations for various grants as part of the Chapter 101, and that was enacted and signed in the concluding days of the session. It was a small appropriation for the Department of Corrections on the House side of $65,000. Both bodies had appropriations for housing of $100 million rather. They took slightly different approaches to them. And then the House proposal for contact tracing had $300 million. So members may want to think through the Senate did workers' compensation claims, and the House had contact tracing, these being the big differences between the two proposals. So the total uses for the Senate was 1.5 billion, almost 1.6. The House was slightly smaller than 1.5. So if you begin to think about the total allocation of 1.869 billion, the Senate proposed 1.553 in spending during the session, and the House had 1.472, leaving a balance based on our math of 316.5 for the Senate and 397.8. And I will hasten to add that given how quickly things were moving at the end of the session, this is not our traditional tracking mechanism, because there were competing proposals that were happening at various times. So we tried to catch the most recent action in reflecting everything that was tracked here. And if you want to fall asleep at night, there's some footnotes to read that go into some of those details. So Madam Chair, with your permission, I'll pause there and see if there are any questions.
Well, thank you. Mr. Nalma, I do appreciate that. We'll come back to you on one portion of this with the appropriations from lines 30 to 34. We'll have to talk about that further. But I do want to remind members that we passed a Senate File 4486, the coronavirus relief account, and that was a bipartisan bill that basically said that there was a legislative authority over the funds of the CRF. And then we passed, it was a three-part series, and so that was part one. Senate File 4563 was the appropriations and transfers to the federal funds source modification, basically saying that what we spent in lines 15 through 28 would be supplanted by, because that was from general fund, that would be supplanted by this CRF fund. And then we also passed, and that was unanimous, I will say. And then Senate File 4564 was the appropriations for counties, cities, towns, and that distribution formula. And that also was bipartisan. And that is something that is still ongoing with that. So I think the Senate has done a very good job at getting prepared with how the monies should be spent. And I see, I wanted to make sure that you understood the House proposal too. We do have Commissioner Franz here to talk about the governor's proposal. But before I do that, I know that as of, I believe it was a Friday, Mr. Nauman, the federal guidelines came out with a new allocation formula for the counties, cities, and townships. And if you could please go through that. And that would be for your lines 30 through 34.
So, Madam Chair, I'm going to call on Ms. Young to maybe pull up the spreadsheet one more time, because I think I hadn't prepared a document to specifically walk through this, but this is a question of how you calculate 45%. And on, I think it was Thursday night, U.S. Treasury has been repeatedly putting up new question and answers that clarify various aspects of the coronavirus relief fund, how money is used, how it can be spent. And late on Thursday, they tucked a paragraph into one of their answers that changed at least the Senate's understanding of how to calculate 45%. And for members' edification, at the very top of the page, if I could ask Ms. Young to move up to the very beginning, the total distribution for the state of Minnesota was $2.186 billion. And members will recall that we have talked, that the committee has talked on a number of occasions about 45% of the total distribution being recommended by the federal government or by U.S. Treasury for distribution to local governments within the state. Up until late Thursday, the calculation was a simple matter of taking 2.186 and multiplying it by 0.45 and arriving at a number that looks like about $984 million. And from that number, Minnesota analysts have been subtracting the 316.9 that was directly distributed to Hennepin and Ramsey counties for the simple fact that they were local governments in the state of Minnesota. And that left a remainder of 667.157, and that is what both bills chose to appropriate. And I believe that the administration had been thinking about that number as the proper number for 45% calculation. I'll hasten to add that the bill itself, the federal bill itself, did not require that that be the exact number, but it more or less implied some guidance along those lines. The information that came out on Thursday night suggested an alternate calculation that begins with the $1.869 billion number on line 8 and multiplies that number by 0.45. And that leaves a total amount for local distribution. And the guidance was clear that this is the amount that should be distributed to non-directly distributed local governments. So in the case of Minnesota, it would be all local governments with the exception of Hennepin and Ramsey. and that number is $841.5 million. So that number, 841.4, is somewhat higher than the 667 that both bills were assuming up until late Thursday.
Okay, thank you, Mr. Nauman. Also, can you go through the guidance about Hennepin and Ramsey before we get to, I know I see Senator Ingebrigtsen with his hand up, and then we'll get to the commissioner, but there is some further clarification as far as Hennepin and Ramsey and their due diligence to their cities.
Madam Chair, I may not be on the exact same page with you at this point. The guidance that we received was that was merely about how to calculate the 45%. Are you thinking about something new or something older than that?
Well, no, I was thinking about if Minneapolis had hit the 500,000 threshold. Yeah.
So that piece is was that's where my confusion was. That was an older piece of guidance that if Treasury, when allocating these dollars in the original instance to provide assistance to folks who are trying to compute how much a state would receive and how much a local government received, envisioned, and this occurred in many larger states like Illinois, where Chicago was made eligible and the Cook County was also made eligible, that if both a county and a city within that county were eligible, they were both made, it was both possible for both local governments to apply directly to U.S. Treasury for a direct distribution. However, when it came to allocating the money, the city in that hypothetical circumstance received the amount equal to its population, its proportion of the population, and then the county was received the amount that was the difference between the county population and the city population. So in other words, the city was subtracted off the amount that was directly distributed to the county. That was not the circumstance in Minnesota when Minneapolis was not made eligible because their population wasn't large enough.
Okay, thank you, Mr. Nauman. Are there any questions? Okay, perfect. I think we'll go to Commissioner France. Welcome, Commissioner. I would appreciate just a walkthrough of what your current expenses have been and what is the future for the remaining 1.869.
Thank you. Thank you. Good morning, Madam Chair, and thank you, members of the Senate Finance Committee. Thank you for the opportunity, and thank you for your opening comments, Madam Chair. I appreciate, we all appreciate your making those comments. It's a difficult time, and it's really appropriate. Thank you for making those comments. So what we've done thus far in terms of the coronavirus relief fund spending has been a total of, we recommended a total of $55.133 million out of the total of $2.187 billion, realizing there were some subtractions from that. But let me walk through that. So on May 21, we provided a briefing for several projects that we have since sent in requests for through the LAC process. So the first one was the critical care supplies that we recommended a $19.484 million request to allow discretionary spending to occur for purchase of critical supplies. This is a little bit like what we did with the Minnesota fund. We asked for a pre-authorization so that we could have a fund that we could access immediately for those really emergency purchases, for example, gowns and caps and gloves and things. So, because as you know, many times those things come open, they're available, but you have to make the purchase within 24 hours or sometimes 6 hours. So the request initially was to provide for that pre-authorization fund through, I think our estimation was through August, so that we would have funds available to make those really hard to get purchases. And we've been really fortunate that Ecolab and some other companies have stepped up to help us with our supply chain analysis and purchasing. And so Commissioner Robert Davis has done a superb job of trying to leverage our dollars as best we can to bring in those needed supplies. So that was the first request that we briefed on May 21, and then we submitted that request to the LAC process that day on May 21, and is now, as of I think yesterday, now has been authorized with the passage of 10 days. So that was the first request we made. The second request we made, there were a series of requests we made. And those were also all briefed on May 21 to the Legislative Response Commission team. What we wanted to do was put together all the chairs that are involved in the LAC process and all the leadership that was involved in the Legislative COVID Response Commission, I think is a proper name, to give all those folks an opportunity to hear what we think needs to be done. So we did that briefing on May 21. The second request we made was for pandemic electronic transfers, emergency SNAP payments. We requested a little over $2 million to expand the vendor capacity for implementation of and to maintain operational capacity for ongoing issuance of emergency SNAP funding. One of the things that happens is that we needed to have an increased ability to make these one-time costs because we had new benefit cards, new EBT cards, vendor processing and operational charges. So that was submitted on I think it was May 22nd, and I think as of today becomes approved because of the passage of 10 days. The third request we made was for prepared meals for homeless shelters and unsheltered adults in encampments. That was a $3.668 million request. This was to provide meals for homeless individuals and folks in encampments to be served in non-congregate settings. Sometimes these are box meals or hot meals, but they provide meals through this mechanism in order to make sure that people maintain social distancing and to avoid the risk of COVID-19 exposure. The next request we made on April or May 21st that was submitted on May 22nd was for seroprevalence studies, serological studies. $1.976 million was requested to help in figuring out the spread of the coronavirus. So the data from this study will be used to track the spread of the virus and direct targeted outreach. This was really through the University of Minnesota to help partner with them to conduct these studies so we have a better sense of how is the virus spreading, where is it going. And so that was submitted and has now been approved. The next one we submitted was a mobile coronavirus testing program for $20 million to implement a mobile testing teams. We have found that the mobile testing system is really important and critical to be able to move around as we get certain outbreaks, situations, or places where we think there may be exposure, but we use them for long-term care settings, residential facilities, homeless shelters, and now correctional institutions as well. So the mobile testing teams are really designed to go to the place where we think testing needs to be done, not make those folks come to us. And we also need to make sure that those people have protective equipment and supplies. We have to have an agreed laboratory in place for these tests, and also a physician to refer people who get the test so they can call and get the results. So this has been a very critical component to being very agile and respond quickly to test situations. The next request is for case investigation and contact tracing software. This was an $8 million request that we briefed on May 21st and submitted on May 22nd through the LAC process. We wanted an IT system that was capable to perform the necessary functions of data management in order for case investigation and contact tracing. As you can imagine, the data coming into that system has to be aggregated and maintained in a very sophisticated way. We needed to expand the testing in order to meet the increasing needs of coronavirus, but we also needed to hire new staff to conduct the tracing, and we're going to talk a little bit more about that in a minute. But we wanted to make sure that we had that system, the initial system, up and running as soon as possible. We had to pay for professional services for the configuration, testing, and licensing costs for up to 2 years. We think the vendor systems have already been vetted, and the Minnesota Department of Health is working with a vendor to implement that program. Those were the requests that we made on May 21st to the briefing to the legislature. We submitted those requests on May 21 and May 22, and those totaled $55.133 million. Those are the only requests that we've made thus far. other than as Mr. Nauman mentioned, there was the agricultural grants that were enacted by the legislature. So that $600,000 there, those total the amounts that we've now accessed with the coronavirus funds. We will be today, we have a briefing set up for later today to brief on a few more projects that we anticipate moving forward on. They're in the development stages. We're not ready to make the request immediately, but they are getting developed. And that is the summer food support program for children. We're looking at requesting somewhere in the neighborhood of $35 million to provide a $50 a month supplement to 350,000 children who are enrolled in free and reduced school meals. This is really using the SNAP and MFIP programs to get this in place for the summer food support for children that are their food supply has been disrupted with the school situation. We're also requesting a $6 million request for emergency food shelf support. As many of us know, food shelves have been really tapped a lot in the last several months, and we need to provide emergency food shelf support to help distribute grants so that these food supplies and transportation to safely distribute food throughout the state of Minnesota. So we would use the funds would be distributed in the grant funds via contract with Hunger Solutions Minnesota, and we would use this to really support the existing Minnesota Food Shelf program. Another program we're recommending is a senior nutrition meal support of $16.95 million, which will be requested to purchase and deliver meals to older adults living in their own homes and have no other source of food for at least one of their meals per day. The funds would be used to purchase bulk food that would be made into meals, frozen meals, shelf-stable meals, packaging and delivering to community location or drop off at the entrance to older adults' homes, a really critical need this summer. And the last one in the food area we'll be talking about today at the briefing is expanded meal access for children and families. This is a $10 million request to create a grant program to provide food and meals to children, youth, and adults without families and families experiencing increased food insecurity as a result of COVID-19. So these would be distributed through the public, nonprofits and schools, faith-based organizations, and tribal nations. And then we're also going to be requesting today, or briefing, I should say, the public awareness campaign. We're requesting a little over $8 million to fund a public awareness campaign to help communicate about the coronavirus and how it is spread and what individuals can do to personally slow the spread. As we open up the economy, one of the critical things, and we start doing more contact tracing, we want to make sure individuals understand the ability to get tested, where they can go to participate in our epidemiology studies to find out who's been exposed to the coronavirus. There are a lot of Minnesotans who are still not seeking testing, even though it's available. We really want to make sure that the public, that we reach out to them and they know where they go and how they can go about doing it. This will help us develop messages and media ads, as well as toolkits for community members who can use this to adapt their materials for specific communities. You know, one of the things that we want to do is make sure that everyone gets the same information, has access to the same information. And we particularly want to make sure that this information gets communicated now during the summer before there's a potential outbreak again this fall. So those are the programs we'll be briefing later today, to the legislative briefing process that we have set up. You know, as Mr. Nauman mentioned, there are a number of programs that are on the list that he just described that we've been working with the legislature. The small business grants is one of those that we've worked with the legislature, and I think we're really, really close to coming up with an agreement on how to proceed with that to help small businesses and make sure that they have some funds during this difficult time. We're also working with the legislature on housing supports to prevent homelessness among those who may be unable to pay rent or make mortgage payments. And we're also working with the legislature on telemedicine as a way to help community clinics and hospitals and other facilities get some of that equipment that they need in order to use more telemedicine when appropriate. And distance learning connectivity is another area we've been working with the legislature on to give grants to school districts and charter schools to help them provide that broadband access to students who are learning from home. So those are areas, as Mr. Nauman pointed out on the spreadsheet, where there's a continuing work with the legislature, and obviously working on the local distribution to local units of government. So with that, Madam Chair, I think that kind of covers what we proposed in terms of what actual proposals we have made or will make today. And we can talk, I don't know if you have any questions about that before we talk a little bit about what else we're looking at doing in the future.
Thank you, Commissioner. I just have a couple questions before we'll turn over to several senators here. The first one is, you have mentioned several times the legislative briefing process, and I'm really not familiar with that, or should I be? Did I miss something?
Which one, Madam Chair?
The legislative briefing process. Can you, yes. You kept mentioning the briefing process.
Yeah, so on May 21, we put out an invitation to all members of the LCRC, the 10 members of the LCRC, the Legislative COVID Response Commission, and all of those chairs who were directly involved in the programs that we were getting ready to make a recommendation on. We sent out an invitation for all members to join us on May 21 for a briefing, and we had a briefing about an hour and a half or so going through those programs, and we've sent out that request again today for those members who want to be briefed on our next set of proposals. So that's what we've been doing to increase the opportunity for members of the legislature to hear our programs before we make a request for any funds.
Okay, I guess I'm not familiar with it, so I'll have to check with Miss Gredvig on that. I'm just looking at that.
Well, I know you got the invitation, but I'm not sure.
Did you? Okay. My other question is,
Madam Chair, if I could, to this point, Commissioner Franz, for reviews like that, it might be best to coordinate through the finance chair. I didn't know there was a coordinated effort between the governor and the legislature, and the fact that Senator Rosen wasn't involved in the planning probably was a misstep. But I think going forward, if you coordinate through the finance chair or leadership, might be more effective in getting the legislature to be aware and participate.
Commissioner?
That's fine, thank you. We're pretty clear in our invitation to leadership and all the chairs, but I apologize if there's any miscommunication. We'll make sure we double check on that going forward.
Okay, thank you. That I would appreciate it. And the public awareness campaign, have we already spent money on a public awareness campaign?
You know, in my list, I don't have the fact that we have that on our list. If it was in the Minnesota fund expenditure or in the public health expenditure, I'm not familiar with it if it was.
Okay. I'll have to take another look at that. And yeah, that's it for my questions. Senator Benson.
Thank you, Madam Chair. Commissioner Franz, the coordination of money for telemed was a little bit of a surprise. So if you could let me know who you're coordinating with at the legislature for telemed spending, I'd appreciate that. I did hear you say that the software contract was for 2 years. When we asked MDH if they were going to use the federal COVID money for something that went beyond the 12/30 deadline, they said no, they were looking at other sources for continuing that contract. And now I'm hearing that there's a 2-year contract. When are we going to get to see the length of the contract and where the money's coming from? Because it's my understanding, and I'm happy to be corrected, that the COVID money has to be expended, not just encumbered. And if encumbrance is okay and we're going to do a 2-year contract, that's different than what I'd been told. So if you could clarify the software contract timeline, I'd appreciate it.
Sure, Madam Chair, Senator. No, you're exactly right. The funds, CRF funds, as we're talking about today, must be expended by 12/31. So what you'll be hearing about today in the later briefing today, and I'm sure they'll be reaching out to you as one of the chairs involved, that this campaign the money spent is for the ad campaign for this year. The contract provides for some ongoing contractual relationship with the media firm, but the expenses would solely be related to the ad campaign based upon, well, in fact, this particular one is for this summer and this early fall. So all the costs would be expended in this year for the initial campaign this summer.
And so, Madam Chair, Commissioner Friends, why do we need a 2-year contract for anything? If
Senator,
it's COVID related, then 2 years is a very long time.
Well, it's my understanding, Madam Chair and Senator, that this would be used in order, because of their expertise in this area, we would have the opportunity to go back to them and purchase more services under the contract that we've negotiated now. So it's not that we would be obligated to use that contract, but we would have that available in the event that we wanted to do additional campaigns this fall, or if next year we continue on, then that would be, obviously we'd have to use different set of money at that point after the end of this year. But the goal was to make sure that we had their services, their expertise available to us to do future ad campaigns. So it's really just, it's an opportunity for us to keep them at this rate going forward.
And Madam Chair and Commissioner Franz, so the software contract, the public relations contract, are those for a term longer than the authorized federal funds?
Madam Chair and Senator, the use of the federal fund that would be used in this contract would be for services rendered for this summer, for this ad campaign for this year, before 12/31/20. The contract does go on beyond that in order to make that firm available to us if we decide to use them going forward. It's not, there's no obligation to use them going forward. It simply provides an opportunity to use them, but we would use all the money we're requesting would be for the ad campaign for this summer.
So, and Madam Chair, I still am not getting an answer on the software program, the $8 million software program for testing, tracking, and tracing. Does that contract go beyond 12/30?
Oh, Madam Chair, I'm sorry. I thought you were still talking about the public.
I'm sorry, I was not clear. Thank you.
No, that's right. So on the IT for the contact tracing, I do know that once again, that money is designed to get the IT system up and functioning immediately for the current contact tracing efforts that we'll be engaged in now. I don't know how long that particular contract would run, but it's, once again, even if it goes beyond 12/31/20, and I don't know that it does, what we're contracting with them to do is for the immediate standing up of the IT system that the contact tracers can use to immediately begin contact tracing in Minnesota, this immediately or as soon as possible.
Senator Benson.
So, Madam Chair, I just want to express again my concern that we are going to be making obligations to vendors the legislature has no visibility on, but might have nexus to general fund spending after 12/30. And if we're going to do this cooperatively, then it can't be, well, the administration signed the contract, so you're going to have to keep this promise.
That's exactly right.
So that's my
Senator,
concern.
you covered this very well in your committee last week too, and I thought the message was loud and clear. Commissioner.
No, Madam Chair and Senator, I agree with that concern. And what we're trying to do is to maintain flexibility and access to services and opportunities without committing the state to any payments beyond the funds that we request. I mean, it's an availability issue. It's not one of making commitments beyond what you're seeing the request for. So I appreciate your concern, and I would agree that we don't want to encumber the state beyond what we're currently working on in terms of the COVID-19 response right at this particular point. So I appreciate your concern.
Senator Benson. Commissioner, also, you did have a public awareness expenditure of $2.25 million from the COVID Minnesota Fund, Action Order LCRC 12.
Thank you, Matt. That was number 12.
Yes. Mm-hmm. Senator Ingebrigtsen.
Thank you, Madam Chair. I too, Commissioner, thank you. I have some real issues with the public relations additional campaign here. I have it really hard to believe that our Minnesotans aren't very familiar with what's going on and the resources that they have at their basically at their fingertips. I get, of course, we all get updates every day, and with the media and the governor's exposure on TV, it just seems like spending any more money on that seems a little concerning to me. I was wondering more so on that $20 million request or expenditure on the mobile unit that you have. Can you explain that a little further? How many people are involved in that? And maybe, obviously they don't have to go out too far from the metro because most of it's in the metro or 7-county areas, other than some pockets here and there, rural wise. What kind of a mobile unit is that for $20 million? And those are temporary employees, I'm assuming, or are they people right from Minnesota Department of Health or where?
Commissioner.
Madam Chair, Senator, you have a lot packed in there. So let me try to deal with all this. So I think one of the things that in all these requests that you see that where you need additional staffing, that has been a constant challenge, is where do we find the talent and the people to fulfill these roles? As you know, there are a lot of people who are now looking for jobs. So there's an opportunity to find short-term employment for certain people. But one of the challenges is being able to stand up this mobile unit and get the people we need to run it and be be trained in order to do it effectively. So I don't have a lot more information. I think at the briefing that's scheduled later today, and we can certainly provide more information. Again, I'm sorry, this one's already been approved. What we'll do is we'll make sure that the committee has additional information that was submitted on the LAC request. But I don't have any more information about the number of people and sort of the transition, how quickly it's getting stood up at this particular point. I do know that the goal was to once again to go out to these places where people are instead of making them come to us. But to your question though about the ad campaign, I do know that not everyone has access to all the information that we would like, and we're still finding a number of people who do not sort of appreciate or have an awareness of where they can go, that they don't have to pay for the test, and how they get the results of the test. So there's a lot to go into that to make sure that all elements of our community have this, because clearly we're all benefiting from people getting tested and being concerned about their social distancing processes. So we think this really benefits all of us to make sure everyone in the community has this information. But I'll get you more information on the mobile coronavirus test.
Thank you, Commissioner. And a follow-up. This is thank you, Madam Chair. This is taking a significant amount of administration time and effort. How much, and I haven't heard this, how much of the money coming from the federal government is being utilized for administration of all these programs, whether it be your office or MDH? Can you give me an idea? Is there, and maybe Mr. Nauman can help with that, is there a certain percentage of these dollars that are going to be utilized like any other grant that comes down from either the state or the federal government? Certain amount of fees that are charged off to the agencies? Do we have any idea about that?
Madam Chair and Senator Ingebrigtsen, I've seen nothing in the law or the guidance that specifies a specific percentage akin to what you're used to seeing in many of the agencies in your budget area, for example.
So then there's no, I mean, there has to be some record keeping, obviously, of whoever's gonna, and I'll go right to the mobile employee thing. Whoever's setting that up is gonna have to spend some state resources or state time on it. And is that being charged off? That'd be a question that I would have, Commissioner. And I'm assuming that, and I'll end with that, with these questions. I also assume that the finance chair will have a little better idea as to what's going on if she intends on going to these committees, and she will keep us abreast. I'm just assuming that, Madam Chair. Maybe I should not be, but.
Mm-hmm. Thank you, Senator Ingebrigtsen. Yeah, I think there are some questions, and I think you hit it on the mobile crisis testing is 20 million. And if the question of how many people does that include, how does that set up, and how did you even come to $20 million? Those are the questions that obviously we need to figure out where this money is being spent. And I'm hoping that the commissioner and his fellow commissioners can give us better direction and give the finance committee better direction on that.
Madam Chair, if I could just add to that, I personally think it's a good idea. I mean, to bring the testing to the person. I mean, especially those that have been ordered to stay at home or not, move around. I get that, but just how does that break down is what I'm wondering.
Right. How'd you get
Madam
to
Chair?
Yeah, Commissioner France.
Yeah, Madam Chair, Senator brought up, Inga Britson brought up another good point about the reimbursement of state expenses. So our understanding of the federal law provides that we can seek a reimbursement through the CRF, the Coronavirus Relief Fund, for state expenditures that are in response to the COVID-19 crisis. And Senator raised some good points. We have experienced a lot of activity in a number of agencies related specifically and solely to the COVID-19 response. Our initial estimate is about $50 million would be subject to reimbursement for state agency expenses. So what we did, gosh, this was in March, I believe. What we did at the very, very beginning was we made sure everyone knew that they needed to code their activity in terms of their entry of time. And if their time was related directly and specifically to COVID-19 response, then they should allocate that time on a daily basis to the COVID-19 response or not. And so we've been tracking that very carefully to make sure that on real-time basis, every pay period, agencies were tracking what folks of theirs were working exclusively on COVID or to whatever percentage on COVID-19 responses. There have been a number of agencies like the Minnesota Department of Health, the Minnesota Department of Corrections has had a lot of folks working on this too, because the unique nature of protecting the populations there. Direct Care and Treatment has, DEED obviously has in terms of setting up the unemployment process and making that work. So Minnesota Management and Budget likewise have, I don't think I've worked on anything other than COVID-19 for about the last 3 months. So what we've tried to do is capture that so that depending upon the availability of these federal funds, if we have enough available, we can use some of that in addition to what, Madam Chair, you had directed in your bill. We also have the ability, we believe, to appropriate up to $50 million at this point of the Coronavirus Relief Fund to state agencies for their direct expenses on COVID-19.
Okay, thank you. Senator Kiffmeyer.
Thank you, Madam Chair. Thank you, Commissioner Franz. Good to have you here today. Appreciate that. So I have a couple very specific questions. One of them is, has the money dedicated in the CARES Act, Hennepin County, 320 million plus, I believe, almost 321, to Ramsey County, about $96 million. Has that money already gone out from the state to these counties for their uses as of today? Has that money gone out to them? Is there any needed action to see to it that this money goes out to them directly? And then, Madam Chair, I have a couple other questions too.
So Senator Kiffmeyer, I can answer that. That money went directly from the federal government to Hennepin and Ramsey County. So they are in possession of that money. Is that what you're asking?
Thank you, Madam Chair. Yes, I wanted to get it on the record and be explicitly clear, because I hear from counties, the other counties, we have another 85 counties, and they see that Hennepin and Ramsey have their money. It was directly to them to meet their needs. So they're saying, what about our other counties, our other 85 counties? They're very concerned. Commissioner Franz, you talk about state agencies, counties, same situation. Matter of fact, the state of Minnesota depends greatly on the counties and many times the cities as well to do a lot of the implementation of these things of COVID that come directly as under the direction from the state of Minnesota. So in regards, as we've heard today, since the 45% is a little bit different calculation than what we had thought, there's actually going to be 841,464. So these counties are very, very concerned. Meantime, they've been expending money. You're saying that the state of Minnesota has kept track of your agencies and that 50 million. These counties and cities have expenditures. They need this money. So Commissioner Franz, what is either your plan, and I would say, what is your formula for distribution as you see it right now? We've had the House conversation about their formula. We have a Senate conversation. I would like to hear from you, Commissioner Franz, what your thoughts are on the $841.464 million that needs to go out to these counties. So what are your thoughts, Commissioner Franz, from your position as Commissioner of Minnesota Management and Budget?
And thank you, Senator Kiffmeyer, for that question. Actually, I do look forward to Commissioner Franz's answer. Commissioner Barley from Department of Revenue has been working on this also. She was invited to the hearing, and we didn't receive a response because I was actually anxious to hear her response on this. And I was scheduled to have a conversation with her on Friday and didn't receive a phone call back Friday nor yesterday. I'm hoping to maybe get a response today. I understand there might be some runs from the governor and the Department of Revenue on their formulation. And I just want to remind everyone that the Senate was very responsible. Talk about quick to the punch and making sure that we created a fair, equitable, quick formula for all 85 counties. And there was a very good proposal on the table from the Senate to help out the cities of Hennepin and Ramsey. And I have not heard back from the commissioner. So Commissioner Franz.
Madam Chair and Senator, well, thank you for the question. I think it's been clear, and that Commissioner Bowery has been working very hard in coordinating, I think, with you and with Chair Marquardt in the House about our goal is really quite simply is to get the money out as quickly as possible. And just, I mean, I think we all agree that the money needs to go out as quickly as possible. Obviously, the federal guidance, when it's changing, makes it just even more challenging. But our goal was based on a population distribution to get the money out to the counties immediately. I think one of the disputes we had for some time was whether to what extent the Hennepin County, Ramsey County money would be part of that discussion. And it was our position that that money was granted directly from the federal government to Hennepin County and Ramsey County, but that we should, in addition, then use the rest of the monies available at the time, $667 million, to distribute as much as possible. Our goal, as I mentioned, is to get it out as quick as possible. We think it needs to make, the counties and cities need to know that there's workers' compensation that may come out of that. There's the need for, so there's a public health costs, local public health costs that may come out of that in the future. And also the FEMA match. As many of you now know, the federal government allows states and local units of government to use federal dollars, federal coronavirus relief fund dollars to meet their match. Because normally there's a 25% local match required. And historically over the years in natural disasters, the state of Minnesota has provided that 25% for the local units of government. But I think given the limited amount of money, we would want to make sure that the local units of government know that that's another issue that may need to come out of these funds as they plan for the use of the funds. But Senator, we agree that the funds should go out as soon as possible. We've got this new guidance that we need to discuss and talk about. But I think our goal is to likewise make sure that the cities and counties get this money to help them reimburse as soon as we can. I know that Commissioner Bowery is eagerly waiting to work with the chair and Chair Marquardt to come up with a solution that everyone can agree with. And as you appreciate, Senator, these distribution formulas are always complicated and no one ever agrees with all of them. But I think that's our goal, is to work with the local units of government, with Chair Rosen and Chair Marquardt, to get a resolution of this and get this out as soon as possible.
Madam Chair, just a follow-up to that.
Yeah, Commissioner, I just hope that I have been waiting for a response, and I have not received anything, nor a response towards our invite to this hearing. And I don't think that's ever happened before, where I have never had a response back. Senator Kiffmeyer.
Yes, Madam Chair, that is very, very concerning. We hear the words about working together with the Senate, but if they don't call back and don't respond, how can there be a true statement of we are working together? So, Commissioner, when I hear this FEMA match, are you thinking that this FEMA match would come out of the other 85 county portion, the $841.464 million as it right now? Are you suggesting that you would subtract the 25% FEMA match from that amount? I mean, I just want you to realize that the state of Minnesota keeps in their account, I believe the 55% comes out to $1.028 billion. I think the state has plenty of funds to cover that. But are you suggesting that the FEMA match would come out of this $841.464 million that's supposed to go out to the counties and cities?
Madam Chair, Senator, first of all, let me just be clear that I personally know that Commissioner Bowery has reached out. And so I'm sure that whatever miscommunication there's been, she has responded and has reached out to you, Madam Chair. So we'll try to make sure that that connection gets made. But I think
Commissioner, yeah, she's reached out, but I'm awaiting a reply back on my last offer. And that was supposed to be on Friday.
Well, that's fine. The implication has been that, but you've been saying that she hasn't responded, and that's just not accurate. And I just want to.
As I said, I've been waiting for a response as of Friday.
On the FEMA match, it depends. Not everything is subject to FEMA reimbursement. One of the things that we've done at MMB is to add some response person to help us track the FEMA application. So as you know, Director Kelly at the State Emergency Operations Center is an expert on disaster responses and FEMA responses. And that team is working both with the state and local units of government and anyone on any unit of government on what a FEMA application would look like and what qualifies. Not everything.
Commissioner, if I can just interrupt though, I know that our time is so limited here. My question was very specific. For the FEMA match, is it your intention to subtract 25% of the $841.464 million to take that FEMA match out of that money or out of the rest of the 55%? Very, very specific. What's your thoughts there?
Madam Chair, that's what I was getting to. Sorry, Senator. The question is that if there's a FEMA application that requires a 25% match, we're simply saying that both the state and the local units of government need to be careful because we may not have enough money to cover the normal state FEMA match. And it may need to, if they're going to make if a local unit of government is going to make a FEMA application out of the funds that they're getting, they may need to use some of those funds to help with their local match. That's all we're suggesting in certain cases, if that's necessary. We would not take 25% off the top. I'm simply suggesting that we all need to be cautious as we go forward. And if there are FEMA reimbursements, we've got to figure out where does that 25% local match come from. We're simply suggesting that the CRF money might be one of those sources that can legally be used.
But there's
Thank you, Madam Chair. I just wanted to be clear about that, Commissioner, because I know the counties and the cities out there are really in a tough situation right now. And it's going to be a challenge as it is with the 45% allocated to them. And generally, the state itself has picked up that local match. And yes, the CARES Act money that is apportioned to the state can also be used for that. I'm just being very careful that these counties are not having what should come to them, especially when the state has usually covered that match. And Madam Chair, I will maybe have another question, but I know you have other members and I'd rather yield time to them now and that I will save my other question for after others are done, if you could call me later.
Thank you, Senator Kiffmeyer. Yes, Senator Newman.
Thank you, Madam Chair. Commissioner, just a couple of different areas that I wanted to ask you about. You mentioned several times that MMB and the governor have been working with the legislature on with respect to this COVID funds. Other than the legislative briefing process, which I will tell you I was also not aware of, and might suggest that you coordinate that through the finance chair. But other than the legislative briefing process and the LAC process, which is required by law, what other specific steps or processes have you and the governor put in place to work with the legislature?
Commissioner Friends.
Madam Chair, Senator, well, I think one of the things we've done is respected those areas where we have been working together, as I mentioned, in the small business grant program and the residential housing support program. We are continuing to support those issues where there was negotiation that was going on at the end of session that almost got to an agreement that was very, very, very close. So what we're trying to do is to continue to support those continuing negotiations to get those to come to a conclusion so that they can either be included in if there is a special session at that time, or they could be submitted through this process. So the two ways we're primarily doing it is through continuing to work through those areas where there have been some agreements, some progress to get some things done, and then through the briefing process with the members to let them know what requests we're having coming forward. So those are the primary two ways that we, in addition to normal outreach by different commissioners, have a lot of outreach, for example, in some areas. So we're trying to promote that as much as we can during this time before we have a next special session, whenever we do.
So other than those three
Or Senator.
methods that you've just described, that would entail or compile all of the ways that you and the governor have been working with the legislature. Is that correct?
Well, Madam Chair, Senator, it doesn't include obviously the governor's direct contact with leadership, but yes, in terms of what we're doing in terms of funding mechanism, yes.
And Madam Chair, Commissioner, specific to the LAC process, that's a statute that is, frankly, not a lot of fun to read. And just so to help me follow what you are doing in the future, would I be correct that the procedure under the LAC statute 3.3005, that what you are following with respect to this COVID fund is the interim procedures under urgencies? Would that be correct?
Commissioner.
Madam Chair, Senator, yes. I'm looking for my copy of that if I have it handy. Yes.
Okay, and thank you, Commissioner. I just wanted to make sure that as I follow your decisions that I am in compliance with the LAC, that I understand exactly what you're doing. And then my final question, Commissioner Franz, is I've been looking at some of the documents regarding procedures and what is expected of the state governments that receive the money. And one of the areas in terms of guidance indicates that the government, in this case would be the state of Minnesota, is responsible for deciding what expenditures are necessary due to the public emergency and responsible to demonstrate compliance with the three uses of the coronavirus relief fund. My question, Commissioner, is does MMB and the governor currently have a written plan in place that would show how you intend to demonstrate compliance with those three criteria?
Commissioner Franz.
Madam Chair, in terms of, you mean with all funding, are you talking about local units of government in general, in particular, or just in general, the compliance process?
The guidance document that I'm looking at talks in terms of whatever governmental entity receives these funds and spends them, and local governments are included in the receipt of that sometimes, as is, say, Hennepin County and Ramsey. I'm not talking about that. I'm talking about the state of Minnesota. The governor receives the money. He spends the money. Federal guidelines or guidance is indicating that the state, i.e. the governor, is going to be responsible for demonstrating that spending the money is done in compliance with the 3 criteria, which I assume you are aware of. And I'm simply asking, do we have a written plan from MMB and the governor to show how you intend to demonstrate compliance with that federal request?
Madam Chair,
Commissioner.
Senator, we are working on that right now. So what we did initially was to make it clear in our guidance to agencies that were using any of this money or might be using any of this money, or to any recipients of the money, that we always made it clear that these were the requirements. The money had to be used. You had to certify that the money was being used for the correct purpose, and that your certification, wherever you were, would be important for you to later be subject to potential audit by the federal government. So what we're doing in the meantime, we have set up a new office, if you will, inside of MMB, and that office is designed specifically and solely to make sure that all federal dollars, people are made aware of the tracking requirements, the internal control requirements. We have loaned our director of internal controls for the state of Minnesota to develop this office and guidelines so that in real time, as agencies spend any of this federal money, that they are tracking the purpose, the expenditure, and they have internal controls to make sure the correct sign-offs have been implemented. So we are in the process of developing a very sophisticated model. We've given the guidance, general guidance, but we're also now developing a very specific model with follow-ups and internal controls of our own to make sure this guidance is followed by everyone who uses federal dollars. So the answer is yes, we're in the process of doing that. It's not completed yet.
And Madam Chair, thank you for that, Commissioner. So we've got a new office within MMB that is addressing the compliance issue in terms of how the money is being spent, and that plan is being created. Can you tell us when do you anticipate this plan is going to be completed, and do you intend to share it with the legislature? And the reason I'm asking the questions, Commissioner, is you're really dealing with a whole lot of, at least in my estimation, a whole lot of money. And the governor apparently has got a great deal of latitude in how that money is to be spent. Having said that, the state has to show that we have properly complied with the criteria. And in my mind, the state includes the legislature. So that's my question. When this plan is developed, when's it going to be done, and are you going to share it with us?
Commissioner.
Madam Chair and Senator, I asked for it to be done yesterday. It's not done yet, and so we're working on it as fast as we can. I'm not sure. I think it'll be done soon, as in days, not weeks, and we will share it with the legislature. And you're absolutely right that it's an awesome responsibility, and it's critical that our goal is to put up on the website and make this transparent. We want to show all the requests that we've made for the funding, whether it was through the Minnesota Fund or whether it's now through the Coronavirus Relief Fund. We want to post all those requests. In fact, all of them have been posted for the Minnesota Fund, and we're now getting ready to do the same thing with the CRF funds or the LAC process. We want to post the request, post the on the website, and post the information that we use to support that. And then we also want to put on, make sure that we're tracking in real time these dollars. I think we're all very concerned to make sure that the money gets spent for its intended purpose and in a timely fashion. As you know, we have to account for these funds they have to be spent and accounted for by the end of this year. So this is urgent that we get it done right away, that we maintain this. Our internal control process for the state of Minnesota is being directed to make sure we apply it to all of these federal funds. And I couldn't agree with you more how important this is. And when we get the document finalized, we'll share with the legislature, because I agree likewise. You should see exactly where the money's going, when it's spent, and what was the authority for it to be spent the way that it was.
Well, thank you very much, Commissioner. And I would appreciate it if you would, as soon as possible, share that document with us, particularly in the Finance Committee. I think that we have the responsibility for oversight. And if you could do that, and then again, consider changing the procedure for this legislative briefing process, because I don't think the word has really gotten out as well as maybe it could have. And maybe you could maybe coordinate that through the Finance Chair. Thank you, Madam Chair.
Thank you, Senator Newman. I do want to clarify too that Commissioner Beverly did not get the notice about the hearing today, and that we will continue our conversations after finance hearing. So wanted to make sure she knows, and you all know that also. Senator Cohen, I accidentally skipped over you. My apologies.
No, that's fine, Madam Chair. I have a couple prospective questions for the Commissioner, but first let me make a comment. I got notice of this legislative briefing maybe 2 hours before it took place on the 21st. And my sense is the notice did not come from MMB or the Commissioner. I'm not sure where it came from, but I don't think it came from MMB. And I know from my conversations with the Commissioner, not since the session, but during the session, he's just, MMB is just overwhelmed, and is the centerpiece, Madam Chair, as I think you realize, for all of this. But I think relative to the briefing, my notice did not come from the Commissioner or MMB, so I want to make that clear. So if I could ask the Commissioner a couple of prospective questions, if that's okay.
Absolutely.
So if we have approximately $360 million left that's not been allocated, is there any, and recognizing, Commissioner, that again, you're working, if not 24 hours a day, maybe 22 hours a day, is there any planning going on, or is it too premature to know what's going to be needed as we get toward the end of the year? Obviously, there's next year's legislative session. Not quite sure as to how much money there's going to be there. And obviously, if the legislature doesn't act immediately, are we left short in terms of what might be needed over the next 6, 7, 8 months?
Commissioner.
Madam Chair, Senator, thank you. I think one of our concerns is that we don't know whether there'll be any more money coming from the federal government or not. I appreciate the Senate's letter to the congressional delegation urging more, but we don't know whether that's going to happen or not. So we have to assume that whatever we have is all we're going to have. And so we are concerned that before we even see the surge arrive in Minnesota and what the effects of that are, that's one of the reasons why we were not in favor of taking some of the money from the CRF and putting it back into the general fund. That may be a perfectly appropriate thing to do at the right point. We just think it's premature. We do not know the nature of what this response is going to require. And I can certainly go through a list of proposals or ideas that we're looking at that more than spend the amount of money that's available. So our recommendation is that we keep that money available and we use it on an emergency basis. I think, we have to remember that we are still in the midst of this COVID-19 emergency. We are still seeing changes occur, like in the long care treatment facilities. We've seen the governor come up with a new plan several weeks ago to really get us to put more resources into providing testing and oversight operations there, training, contact tracing. So yeah, the answer to your question really is we believe that there are more uses of that money than there is of money available at this time. And we would not want to redirect it to the general fund before we feel comfortable that we've gotten through the surge. We sort of have a sense of how we're doing and whether or not there's any more federal money coming. So anyway, I guess our concern is that we've got a number of working groups that continue to focus on areas such as the hospital surge issue, critical care supplies, alternate care facilities, critical care supplies that we know. At-risk populations are still an issue for us out there. The economic security, such as the small business grant program, social distancing process to make sure the businesses know and can open and be effective in their social distancing measures, food security issues, education and childcare. So there's a really long list potential needs. The childcare facilities is one of them that we haven't talked about at all. As we all know, people who are out there, first responders and people in the healthcare industry have to have a place to take their kids for childcare so they can be at work. And so anyway, there are lots of supports needed for local childcare providers that we've made some headway in that response. But anyway, there are a lot of needs that we think still exist, and we're concerned about that going forward. To your question, Senator Cohen.
So, Madam Chair, so thanks. And I wasn't looking, Commissioner, for an exhaustive list. You've answered the question, which is, no, this very well could not be enough. And you've also, I think, answered my second question, which was going to be, do you have any particular insight into what might happen out of Washington in terms of any federal appropriations? And it sounds like you don't have that insight, unfortunately.
No, so I don't.
My hope is that, Commissioner, you take a real hard look what has already been spent. For example, there is money already spent on public awareness campaign. You're talking about doing another one. What can be funded by the feds, such as the contact tracing, that can be perhaps funded by the feds. We don't have to pay for that from our funds. That's a separate federal fund. So there needs to be a big whiteboard, and that's why, again, I think it's important to have the legislature involved in this, as Senator Newman and other Senator Kiffmeyer have obviously said. Senator Nelson.
Oh, thank you, Madam Chair. And Commissioner, thank you for being here today and for giving us the update. I just have kind of a couple brief comments and then a very specific question. And my comments in much of the case have been made by Senators Newman and Senator Rosen. But I just want to add to that what my constituents are wanting to know and what they want really the governor and his administration to know. And it's correct. These are billions of dollars that have come to us from the federal government, that come from our constituents' pocketbooks, just like all taxes do. And their concern is that where are their elected representatives in helping determine where best and how best to spend those dollars? Because truly, the 201 legislators know their districts and the needs the best. I mean, that's why our government is set up the way it is. And we are in uncharted territory in so many ways, significant challenges. And my folks just want to see the legislature involved and not relying on a unilateral administrative decisions as far as priorities, timing, implementation, those type of things. And so you've already heard that a little bit from others, but I want to just mention that it's broader than just the legislators. This is what the people want to know. The people want to know that their elected representatives, whether they be in the House or Senate, are involved in helping us climb out of this pandemic, and also the additional societal upheaval that we're seeing. And so, it's kind of an all hands on deck moment. And I would just say that regarding the legislative briefing, I was unaware of that as well. So I think we've well established that somehow that word didn't get out, but I'm glad to hear I understand there are others planned. And I think that is very important, because by the time the administration's desires for how to use the billions of dollars get to the legislators, in this case, the Legislative Audit Commission, the LAC, which I'm a member of, there is only one option, and that is not to help form a better, more broader plan to address the significant issues before us. But the only LAC option is to delay funding for a period of time. But that's not the point. The point is we need to make sure that we are using every dollar that has come to us via the federal government, via our constituents' taxes, to the best use possible. And I just don't know that one person has, or one entity has that availability. So my hope is that the legislature will be more involved going forward. My specific question does have to do with the $33 million that the legislature, we stepped out before the feds. We knew there were some serious issues coming, and we wanted to make sure that our medical providers that we were prepared. And so we did that. And that included obviously those childcare grants as well, and other things. But I do want to make sure I understand. I thought I heard you say that the Walz administration is not interested in using the federal funds, the several billions of dollars who have come to us through the CARES Act, to repay those funds that have come from just Minnesota taxpayers, even though they're eligible expenses, and because you think there may be other needs coming forward. But my question is, what's the timeline on that? In other words, there's always the challenge that more needs will be coming forward, but would it not be more prudent to use some of those federal dollars that have come our way right now to backfill the $330 million in the general fund that the state legislators put out there, the governor signed right away, because obviously we were all very proactive, and that's what's helped Minnesota weather this better than many other states. But what is the harm in backfilling that state funding right now? And is there a deadline where no longer that will be an option, like December 31st, for example?
Commissioner Franz.
Madam Chair and Senator, well, thank you for your comments. And I certainly agree with the need and desire to work with the legislature. And it's difficult with our new reality to do all that. These Zoom meetings are helpful, and I think it's a good way to do that. That's why we initiated the briefings several weeks ago to begin that process, to increase that process. And we also encourage all the commissioners to outreach to the chairs responsible for their area. So we're trying to promote and facilitate that discussion as best we can. But, let me back up a little bit though. Your timeline issue is really a good one, and in terms of the sort of pressures we're under and the deadlines that we have. So just 1 minute of history. On February 27th, we announced a $1.5 billion surplus and a steady economy. And then on May the 2nd, we announced a $2.4 billion deficit with our budget projection. So in the span of that time, and part of that $2.4 billion deficit that we projected for this biennium, we included in that the $550 million, about the right number, $550 million of legislative appropriated dollars for COVID-related responses. So that is part of our $2.4 billion deficit. So the question becomes, as we go forward, when do we need to solve that math problem, and what is the best timing to use federal dollars to do some of that backfilling? As I said earlier, I think that may be the exact appropriate thing to do. We're just concerned about doing it now, because once we do it and the federal money is gone, there may not be any more federal money coming down the road. And so therefore we won't have the ability to use that federal dollars to respond to the surge that occurs in June or July or August. And we're concerned about not having the availability of those federal funds to move quickly to address the emergency. So on the budget side, clearly we need to, and we've had discussions, with Chair Rosen, Chair Carlson on the House side, a discussion about how do we talk about this issue. I think we all have to think about how we solve this deficit, and we don't have to solve it today. We obviously need to monitor and start making changes that will help us get out of this deficit immediately. And we've already begun that, as I mentioned, in April. Well, in March, we instituted a hiring freeze. It's already showing significant savings. And I'll have those numbers, more solid numbers, in the next week or so, but significant savings in the workforce of the state by controlling the hiring that we're doing. But so that's just one area, but there are a number of other tools. So the question is, when do we sort of tie up that deficit and decide, do we use part or all of the reserve? Or do we use some or part of the federal funds? Do we make some changes to programming changes in the state of Minnesota that the legislature could enact? Those are all part of the tools that we have available to solve the budget deficit. But my point is, to your question, is we don't need to do it today, and we don't need to decide today to put those federal dollars into the general fund. And we think it's premature, and we would suggest that that's a really important option to consider, and I hope we'll be able to do that, which means that we don't need to use all this money for COVID-19 response, but we just think it's premature to do that at this time.
But I do want to say that I feel a unanimous vote from the Senate on that very issue is something that should contain a pretty good impression towards, I mean, we obviously have our different opinions on who should be spending the money, but that was a unanimous vote to replace that money. And Senator Nelson, I know you have a further comment.
Yes, thank you, Madam Chair, and thank you for that comment. Yes, I just want to follow up. With all due respect, Commissioner, my question was not about solving the projected deficit that our state has. My question is specifically about the $333 million that the state of Minnesota appropriated for coronavirus relief early on, before the federal funds were passed and before they got here. And now my question is specifically about what if those funds are not backfilled, if we do not backfill our state general fund using the federal funds, that's an additional $333 million that will somehow go on to Minnesota taxpayers. And believe me, our Minnesota citizens, our Minnesota residents are very concerned about the economic stability right now. So I am concerned about that. And then to my timeline question, I'll be just a little more specific. I want to know if December 31st is the last day that using the federal coronavirus relief funds to backfill the state general fund coronavirus relief funds that we passed at the state level, is that the deadline? Is December 31st this year the deadline for doing that?
And Commissioner, yeah, briefly, we've got 5 more hands that just popped up. So,
Madam Chair, yes, Senator, no, you're exactly right. The money, the federal dollars have to be expended before December 31st of this year. So we would have to either expend them in some other capacity or for something else, or to backfill the general fund dollars. But you know, the general fund backfill is a critical decision, but you have to remember, we have to balance that with saving lives that might be at jeopardy during the surge in Minnesota. And so our first concern is to save lives and have the money available to make critical emergency responses as this coronavirus continues and we see the surge in Minnesota.
Oh, Mr. Chair, or Madam Chair, I just have to say, I am not at all suggesting that we not do something to save lives. I'm just suggesting that we backfill the state fund first. And if more money is needed, then I have confidence the state of Minnesota will step up just like it did before the Fed. So I'm not talking about risking lives here. I just want to be very clear about that. Thank you.
and it does show to the federal government, Senator Nelson, that we have been responsible and that we have used our money appropriately, and that perhaps we do need some more if we do that backfill now. Senator Champion.
Madam Chair, let me first start by saying thank you for your kind comments this morning. I sincerely appreciate it and appreciate our communities being in your thoughts and prayers. So that's important. I think what I'm going to suggest seems to line up in a way that I hope that the committee as a whole and maybe the commissioner can speak to specifically, that relates to the public awareness campaign. And the reason why I decided to say something was because I heard it, put forth a couple of times, whether we've allocated money before. I heard another one of my colleagues talk about the governor's on television every single day, which he is, and speaking so eloquently and clearly around what we need around COVID and any other crisis that we've been facing. The reason why I also think it's important to speak to this issue is because I think the way the questions are coming forward seems to be taking us back to our old way of thinking that doesn't consider the fact that not everybody hears or even understands what the governor is saying each and every single day. It's not that they suffer from the lack of intellectual capacity, but it is because of a number of different factors that I think that we should consider, and I think it's rather thoughtful for the governor and others to say that we need to have a public awareness campaign to deal with the various communities in our wonderful state in order to make sure that we are really thinking about us as one Minnesota and saving lives. Let me lift up a couple examples as to why this would be important. Usually when the governor is speaking so eloquently each day about whatever's going on in the state of Minnesota, and because we're talking about COVID, I'm going to speak specifically to that. He has a person who's doing sign language that's there. And that's important because those folks who need that should have that. Well, let's think about other language barriers. And even if you don't have a language barrier, there may be a barrier around the way a message is framed. And that various communities need to have a tailored message that deals with their cultural issues, as well as hearing a message from a credible voice in order to make sure that they understand and have some clarity as to what is being said. I'll give you some examples of how things with COVID has changed and why these credible voices are important. Early on, when we were dealing with the pandemic, it was stated that young people could not get the virus. And I remember my son, saying, "Dad, I don't have to worry about it because I'm young. It's you older people that have to worry about getting the virus." And I said, "That's not true, son," right? But we've seen how young people have not only been a carrier of the virus, but suffering greatly in the hospital. There's been questions about antibodies, whether someone who's been affected once, whether they can be reinfected. We've even had conversations about young children, whether they could be a carrier and whether they would be impacted by it. And we've seen young children with rashes. And then we've heard a number of people talk about vaccinations and when we're going to have something that will help us deal with this pandemic, without us thinking about various communities have a challenge around vaccinations, right? Whether they're going to even get a shot and what that means, and whether that is looked upon as the government just doing what happened with the Tuskegee experiment and using this as an opportunity to study a group of people. I remember there being said that blacks can't get it. I remember African Americans walk around saying, "Hey, it's the melanin in our skin. We're not going to get it."
Senator Champion, we've got 4 more people lined up, so
I'm sorry.
you can get to your
I'll
point.
wrap it up.
Yeah.
My point is that I think we have to alleviate the one size fit all, and that this public awareness campaign is an attempt in order to make sure that we're looking at the various issues that each community faces and how to address it, so that they're aware as to what things that they should or should not do. And I failed to mention, like, faith. Faith is one. There are Muslim brothers and sisters who pray next to each other. How do you talk to them in a way so that they can respect the social challenges? So all that coming from a credible voice. I just wanted to say that I think it's important for us to take a step back and be thoughtful and ask some critical questions of the administration that I believe that they've been attempting to answer, so that they're responsive, so that we can save lives. And if I missed anything, Commissioner, are those some of the issues that you all have been looking at in order to make sure that there were funds available for these various communities to make sure that the entire public, not just a segment of the public, but the entire public is aware of what they need to do in light of the virus?
Thank you, Senator Champion. Senator Westrom. Senator Champion, are you done? I'm sorry. Are you finished? You still have, okay.
Yes, I was finished. I thought that I had a question, and I just wanted to make sure that the commissioner had a chance to respond, and I wanted to make sure that I was on the right track as it pertains to their thinking.
Okay, my apologies, Senator Champion. Commissioner.
No problem.
Madam Chair, and thank you, Senator. I think, appreciate your comments. One of the things we have found is that the coronavirus, the COVID-19 has not been universally spread around this. There have been really disproportionate effects of this coronavirus in communities, in different communities, and we need to reach out to those communities. We simply cannot assume, as Senator Champion articulates, that we cannot assume that everyone's getting the same message and the correct message and the accurate message and the constant message. And it's on us to make sure that all communities have equal access to testing, equal access to treatment. And this COVID-19 pandemic has really exacerbated some of the disparities that we already have seen in whether it's in education or jobs or healthcare. And it's really a tragic situation, and we have to respond. And as Senator Champion mentions, the media campaign is simply one of those methods, but the other methods are the mobile testing and other contact tracing components, where we really try to make sure we get out to all communities so that everyone has equal access to the information and to the treatment. But thank you, Senator Champion.
Thank you, Commissioner. Senator Western.
Madam Chair, thank you. Commissioner, you talked earlier about some emergency money for housing assistance for perhaps tenants or owners of a house. Can you expand on that? Has that, the Senate did pass a bill the last day with $100 million, had other reforms and other good housing provisions in it. Are you talking about that type of money that the Senate and House had talked about, or is it a different funding that you're talking about for housing?
Commissioner.
Madam Chair and Senator, well, thank you. That is specifically what we're talking about. That is one of the areas where we've seen the Senate and the House working collaboratively on some of these issues. I know they're continuing to work on it, and that we're a part of that process. We want to continue to be a part of that process. We think that's a good example of where the legislature is leading on this issue, and we want to be supporting that effort.
And Madam Chair, Commissioner, where do you see that going? Reason being, it's something I've been working on since the last week of March, and we're still not there. Different times we thought we had agreements, and we haven't gotten there. Is that something you anticipate just moving ahead with either way, or would it be only upon legislative direction?
Commissioner.
Madam Chair, Senator, well, that's a good question. Our preference would be for legislative action. Now, obviously, that depends a little bit on whether there's a special session, whether it's next week or a month, within the next month. Obviously, these kinds of decisions and this kind of money and the need for this money is now, and so it's incumbent upon us to move as quickly as we can. And so we would hope, and our preference is that there can be some resolution of this with the legislative members working on this with the administration to have a legislative solution. And if it can't be as part of a soon special session, then we would suggest that maybe we could move it along through the LAC process. But so we want to be respectful of that process and follow the lead of the legislature. But you're right, we've got to decide soon. And that depends on something we don't know. We don't know when the next special session will be. So that's a real challenge. And if we don't see one coming immediately, I would suggest we should move on it. But that's depending on the legislature. We want to follow the legislature's lead. So.
Senator Western.
Madam Chair, Senator Commissioner France, have you put together a proposal, or are you ready to move with it? And if so, are you using the framework the House and the Senate have passed, generally speaking, or what is the status of where you're at? Because you're right, the need was there in April, at least for beginning dollars. it all maybe didn't need to be then, but it does compound. Although as time goes on, the need might diminish just because people are going to get back to work, and they'll still have a problem, but it won't be continuing as much. But what's the status in your department right now on using that money moving forward? Or and then I have one follow-up, Madam Chair.
Commissioner, and then we're gonna, Commissioner, briefly, please. We have got to finish, and we've got 2 more questions.
Yeah, thank you, Madam Chair. I'll be brief. And Senator, our goal would be to take the framework what the legislature is working on. I don't know exactly where those negotiations are right now, so I don't know what the differences are and how we'd have to reconcile those. Ultimately, if we can't come to an agreed upon legislative position, then we'd have to come up with some sort of alternative solution. I just don't know exactly where the nature of that is, but we would hope to follow the legislative lead on this one. I just don't know. I'm sorry.
Senator Wester.
And last point, Madam Chair, Commissioner, is the governor considering not continuing the emergency powers? And essentially the significance of that is if he's considering we're at a point where he doesn't need to continue his own emergency powers, then the question about a special session is out there. If it's not, the reading of the statute is he has to call us back June 12th if he's going to continue his powers. Is that your reading of it as well?
Commissioner Franz.
Yeah, Madam Chair, Senator, yes. So, I mean, that's clearly I don't know what his decision is going to be. And clearly if he decides to extend the powers, then he will call the legislature back on June 12th. We just don't know. And he's considering all the different data to make that determination, and it's not been made yet. So.
Sure. Thank you.
Thank you, Senator Western. Thank you, Commissioner. Senator Kiffmeyer.
Thank you, Madam Chair. So Commissioner Franz, in the CARES Act specifically, $48 million has been designated for childcare to fund those needs. Have any of those funds been expended currently? And could you comment, if not, what your thoughts or the governor's thoughts are in regards to that $48 million?
Commissioner Franz.
Madam Chair, Senator, I'm 99% sure that it has. So what you're mentioning is that direct grant award to the agencies for the $48 million. And so when that money, different than the CRF money we're talking about now, when that money goes directly in a program to the agencies, what we do is we have to wait for the agency to get the actual award. Then we can move forward and seek LAC approval to spend the money. I believe those have been. I'm sorry, I got so many things in my head. I'm pretty sure that those have been processed and have gone out the door and are being spent, but I don't know to the extent of whether all the $48 million, I think so. I'll have to get back to you on that. I'm sorry.
Senator Kiffmeyer.
Thank you, Madam Chair. Yes, there's some confusion out there about that, and certainly the child care providers that I've talked to aren't seeing the benefit of that. So I'm not quite sure, but their needs are urgent. Their needs are now. Not plans, but actual finances. And the governor has designated them as critical service sector. So they've been taking care of our other nurses, doctors, children, people like that. So, it's been a while already. So Commissioner Franz, could you respond specifically to me in regards to that? And then members of the committee, I'll be glad to share that with you as well.
Thank you, Senator Kiffmeyer. That'd be great, Commissioner, if you could do that.
I will do that. Thank you.
That's super. And then I see Senator Nelson still has her hand up, but she has disappeared. So I'm not sure if she still has a question. Sounds like she doesn't. So with that, Commissioner Franz, thank you very much for your time. I hope you were taking some copious notes about getting some of this adjusted, and obviously respecting and listening to the Senate's position on the funding and going forth with the CARES Act. Certainly understand your position too, but we do need to continue to work together on this. And we have one goal in mind, and that's to take care of the people in Minnesota. We might have different ways of approaching that, but I think it'll all be served better if we all do it together. So
Well, thank you,
With
Madam
that,
Chair. And
Commissioner-
let me just say, to the extent there's been any miscommunication, that's on me. I'll take responsibility for that, and we'll do a much better job going forward to make sure that we coordinate through you, Madam Chair. Because we talk pretty regularly, but sometimes things slip through, and now I'll take that responsibility, and I apologize for any confusion.
Thank you very much, Commissioner. And members, thank you so much for Tuesday morning hearing on finance. I really appreciate it. And for everyone, please be safe. Take care of your communities. Take care of your families. And with that, the Senate Finance hearing is adjourned. Thank you.